So, hello everyone. So, in anatomy, we completed upper limb. So, we will start lower limb from today. Okay. So, basically, in lower limb, what we are going to study that we have bones like pelvic bone. It is coming under lower limb, leg, thigh, and foot. These are the four areas we have to cover in lower limb. So, everywhere you will get the muscles, number one, and nerves, uh, veins, arteries, tendons, and ligaments, and bones and joints. So, okay, also we have to study all this like in upper limb, how you studied in the detail. We will study in this lower limb also. So, today we will talk about in and around pelvic region. Okay, we have to start from that area. So, we will talk about first pelvic area. Okay, so this is the pelvic area. Okay, this is thigh bone, this is leg bone, and this is foot. Okay, here you have pelvic bone, and this is thigh bone, femur bone. This is tibia and fibula, and foot bones. So this is the anterior view of pelvic region. So this is the sacral bone. This is whole is sacral bone. Okay, this is here. We'll get all the sacral fused bones. Okay, and this is ilium, pubic. This is pubic here till here, and this is ischium. This is ischium. Ilium. This is pubic and ischium. Okay, so this is the pubic symphysis. This is pubic symphysis. And if you just show from backward, posterior, this is sacral bone, and this is coccyx or coccyx or tailbone. Ilium, pubic, ischium. Ilium, pubic, and ischium. Three are the main bones of hip bones. This is sacral and vertebral bone. Those are vertebral bone, not pelvic bone. Okay. And the pelvic bone, ilium, pubic, or pubis, ischium. These are the main bones. So if you go in detail of those bones, you will able to see this is the lumbar bone, sacral bone, and coccyx bone. Okay. This is sacral. This is ilium, pubic, and ischium. Okay. So you will have here some names we have to remember. That is, this is greater sciatic notch. This is lesser, not only greater sciatic notch. Okay, and this is called iliac crust. Very important. And this is tubercle of iliac crust. This is anterior superior iliac spine. This is anterior inferior iliac spine. This is iliopubic eminence. This is pectineal line. This is articular cartilage. This is femur bone. In that, we have to remember greater trochanter of femur. This is lesser trochanter of femur. This is pubis. Okay, pubis. Ischium, pubic, ilium. Okay, this is pubic symphysis. Already I told you. Obturator foramen. This is obturator foramen. Ischial spine. This is superior pubic ramus. This is pubic symphysis. Okay. So all these are name we have to remember. Then this is called ligament. This is connecting from anterior superior iliac spine. This is pubic tubercle. This is inguinal ligament. This is inguinal ligament. Very, very important. So because here an important structure is going, that is named as femoral triangle. What is that name? Femoral triangle. Femoral triangle is the important structure here. It is anterior superior iliac spine to the pubic tubercle. It is a ligament. It is called inguinal ligament. So here some muscles is coming from the upper side, that is abdominal muscles. Those are connected with inguinal ligament. Okay. So some of the muscles are arising from this pubic regions only. Pubic region only. Okay. So here one triangle is forming. Triangle is forming. So before that, we have to know what are the muscles are arising from here. Okay. You can see here some muscles. You can see that this is the pelvic region. Okay. So you are able to see some muscles are here. Okay. Some of the muscles are arising here, which making femoral triangle. This is because of femoral bone is there, femoral nerve, femoral artery, femoral vein, everything is coming. So named as femoral triangle. So some muscles we have to remember. What are the muscles are there in the pelvic region? So every time we have to remember the muscles are very important. What is psoas major? Psoas major. Second is iliacus. Third is pectineus. Very important. Fourth is adductor longus muscle. Adductor longus muscle. And fifth one is sartorius. Very long muscle. Fifth one is sartorius. Fifth one is sartorius. Psoas major. Where is coming from? This is coming from a lumbar vertebrae. Lumbar vertebrae and inserted on femur. Lesser trochanter. Here lesser trochanter we discussed. This is here femur lesser trochanter. From lumbar vertebrae to femur. Lesser trochanter. Iliacus. ठीक है. Next is begins from iliac fossa. Iliac fossa and where is inserted on the lesser same femur of lesser trochanter of the femur. Next is pectineus. Pectineus muscle is attached to the pectin pubis. It is attached to the pubis and same. It is inserted on femur. Okay. So this is very important thing. So next muscle is adductor longus muscle. Adductor longus muscle is arising from the pubis same. Okay. And it is attached to the femur. Sartorius. Sartorius is long muscle. It is coming from anterior superior iliac spine, ASIS, anterior superior spine attached to the shaft of tibia. It is coming till tibia. It is very important. So we can see the muscles. Psoas major. It is coming from lumbar to here, lesser trabecular. Okay. Next, iliacus. It is coming from here, spine, ilium to the lesser trochanter. Next, here, pectineus muscle. You can see that ischium pubis to the lesser or shaft of humor. Okay, pubis to shaft of femur. And sartorius muscle here. You can see this is a sartorius muscle coming to the and going to the tibia. Okay, so these are the muscles which are making the femoral triangle. Okay. So if you able to see the femoral triangle, this is the femoral triangle. Okay, what are the boundaries first? Next is floor. This is very important. Content and roof. These are the things we have to remember. First is boundaries. So here we'll able to see the lateral, medial, base, and apex. Lateral side, this is medial, this is lateral. Okay. Lateral side, what are the boundaries in the lateral side? You will able to see sartorius. Sartorius are making lateral boundary. And medial side, we will able to see adductor longus. Adductor longus. Apex and base is by muscles. These are the muscles coming from the adductor longus and sartorius. They are making here apex and base by inguinal ligament. Inguinal ligament. So here sartorius, here adductor longus and inguinal ligament, and here meeting point is base. Sorry, apex. Next floor. On which floor that femoral triangle is situated? Situated is psoas major first. Second is iliacus. Third is pectineus and adductor longus. Okay, these are the four muscles, important muscles. What is the content? What are the content? Content of femoral triangle. First is femoral artery and its branches. Second is femoral vein and its branches. Next is femoral sheath. Next topic is the femoral sheath only. Next is femoral nerve. Next is nerve to pectineus. Nerve to pectineus. Next is genital, femoral branch of genitofemoral nerve. Femoral branch of genitofemoral nerve. These are the content which are crossing from the triangle. Okay, and as well as lateral cutaneous nerve of thigh. Lateral cutaneous nerves of thigh. What is the roof? First is roof. So skin, after the superficial fascia, and another thing is that femoral branch of genitofemoral nerve, genitofemoral nerve, ilio inguinal nerve. That much content are possible. Okay, superficial branch of femoral artery and vein, superficial branch, and great saphenous vein, great saphenous vein. These are the passing through the floor. Everything is content, floor, boundaries. We studied femoral triangle, content going past through. You can see femoral branch of genitofemoral nerve. Okay, femoral nerve. Okay, this is artery, common femoral artery. This is common femoral vein. This is adductor longus. This is sartorius. These are the inguinal ligament. Three making here This is greatocephalous vein. This is okay. All these are formed. Then sartorius adductor longus. Okay, femoral nerve. Okay, everything is passing. You have lateral sartorius adductor longus, roof fascia lata. ठीक है, muscles. Okay, I discussed content, femoral artery, femoral vein, femoral nerve, deep inguinal nodes. You can see like this. This is able to see from upwards, like from front, from upwards. Okay, front region, superior. Okay, if you do the dissection, cut section of the femoral triangle. Okay, so this is all about femoral triangle, where the femoral triangle is. It is the area. Inguinal. This is the base inguinal ligament. Okay, here is coming sartorius. Sorry, not sartorius. Sartorius is coming from here, and adductor longus is coming. Okay, adductor longus from coming here. So this is the area where you will able to see the inguinal, sorry, femoral triangle. Okay, so this is all about in today's class. So we completed femoral triangle. In next class, we will discuss about femoral sheath and femoral artery, femoral vein. Everything is there. We will discuss in coming class or in detail. Okay. So thank you. Thank you very much.